Today's podcast is brought to you by Audible. Get a free audiobook download and 30-day free trial at washingtech.com/book. Over 180,000 titles to choose from for your iPhone, Android, Kindle, or MP3 player.
Moving the needle. Welcome to the Washington Policy Podcast.
Curating communications, media, and tech policy news so you don't have to. News, interviews, everything you need without the axe to grind. It's the Washington Tech Policy Podcast with Joe Miller.
The FTC spotlights celebrity product endorsements, the U.S. takes steps to protect voting machines from cyber attacks, and Jermane Bond is my guest. The Federal Trade Commission plans to crack down on celebrity product endorsements on social media. The agency thinks the endorsements aren't transparent enough because they don't often contain explicit statements that the endorsements are actually paid advertisements. So this will affect celebrities like DJ Khaled, who promotes Ciroc vodka on Snapchat, and other celebrities who earn revenue from sponsorships in exchange for giving products their stamp of approval. The FTC has brought lawsuits against several companies that secure product endorsements from celebrities. But marketing executives think this is an overreach, saying that these celebrity influencers recognize the trust their audiences place in them and would never violate that rapport by endorsing products they don't actually believe in. Experts are advising celebrity endorsers to now include hashtags in their sponsored posts, with hashtag ad being the preferred indicator, although these hashtags often get jumbled up with a bunch of other hashtags. Sarah Fryer and Matt Townsend at Bloomberg have more. The U.S. is concerned that voting machines will be hacked on Election Day. Remember that crazy 2000 election that was ultimately decided by the Supreme Court? Well, picture that scenario, except no one even knows where to start counting since the entire system was hacked. The problem is that with more than 9,000 voting districts in the U.S., it's quite a task to monitor all those. So the Obama administration is considering whether to designate voting machines as critical infrastructure. Check out Julie Hirschfeld-Davis's coverage in the New York Times. So if you're in or around a courthouse, you may want to watch what you say, even if you're talking to your own lawyer. Apparently, the FBI placed bugs in and around the San Mateo County courthouse while they were investigating an alleged foreclosed homes bid rigging scheme. The FBI started out the investigation sending undercover agents with wires, but apparently the agents fell out of favor with the suspects, who began sharing less and less information with the undercover agents. So the FBI decided to try and capture the suspects' conversations at the courthouse. But they went ahead and captured everyone's conversations, including people discussing things like their sex lives. In any case, U.S. District Judge Charles Breyer issued an order last week suppressing over 200 hours of audio recordings because he found the suspects had a legit expectation of privacy, and so the surveillance tactic violated the Fourth Amendment. But technically, the FBI can keep placing bugs outside courthouses, since another federal judge in San Mateo issued the exact opposite ruling in another case, saying the suspects in that case didn't adequately protect their own privacy. Joe Mullen covers the story over at Ars Technica. Privacy Shield went into effect last week. That's the privacy deal worked out between the U.S. and European Union after lawyer and Ph.D. student Max Schrems, who is Austrian, successfully challenged Facebook's privacy protection practices. Schrems filed 22 complaints against Facebook in Ireland, which ultimately led the EU to strike down the so-called safe harbor, which for 16 years had governed transatlantic data exchanges between European citizens and servers in the United States. After the safe harbor was struck down, tech companies had to make individual agreements, which proved cumbersome, while the U.S. and EU negotiated an alternative arrangement that would protect Europeans' private data from the prying eyes of the National Security Agency. The result is the Privacy Shield, but 28-year-old Schrems thinks the Privacy Shield still isn't good enough. Adam Santariano and Stephanie Bodoni covered this for Bloomberg. In a letter to Congress, the U.S. Copyright Office weighed in on the Federal Communications Commission's proposed rules to open up set-top boxes to competition. The goal is to allow consumers to choose which set-top box they access content from, instead of being stuck with the box that they lease from their cable provider for an average of $231 a year. The U.S. Copyright Office wrote that the FCC's proposed rules would give rise to widespread copyright infringement. The Electronic Frontier Foundation's Mitch Stoltz argues that the Copyright Office's legal analysis is full of holes, mainly because it fails to account for the fact that copyright law doesn't confer any rights with respect to how the technology that consumers use to access the actual copyright material is designed. Check out Mitch Stoltz's analysis at EFF and John Bergmeyer's analysis at Public Knowledge. The Justice Department has decided it will not update the consent decrees performing rights organizations ASCAP and BMI entered into back in 1941. Those agreements set the standard for how media outlets would pay royalties to musicians. But, of course, the internet wasn't around then, and ASCAP and BMI had sought to have the consent decrees updated for the digital age. The Department of Justice declined and actually are adding a rule requiring ASCAP and BMI to get clearance from all of the artists who contributed to a song and pay each of them their share of royalties. This is known as 100% licensing. ASCAP and BMI, of course, were not happy with the decision, arguing that it would lead to musicians being paid less for their works. Ben Cesario has the full story and analysis in the New York Times. Finally, a former technician at the FBI has pled guilty to charges that he spied for the Chinese government, providing sensitive intelligence to Chinese officials in exchange for travel reimbursements, cash, and even prostitutes. Kun Shan Chun, a Chinese-born naturalized U.S. citizen, faces 10 years in prison. Camila Domonoski covered this story for NPR. Stay with us. For Washington Tech Policy Podcast listeners, Audible is offering a free audiobook download with a free 30-day trial to give you the opportunity to check out their service. You'll be amazed at how much time Audible will save you. Why not listen at the gym, in the car, or on your morning run? How about The Warmth of Other Suns by Isabel Wilkerson?
It would not have occurred to them that they were writing history. They were leaving as a family, not as a movement.
You can download The Warmth of Other Suns or another audiobook free by trying audible.com. Sign up for your free audiobook and 30-day trial today at washingtech.com/book. Health IT has great potential to change health outcomes in a variety of different ways. Today, we're going to look at how health technology can help close health disparities among African American men. My guest today is Jermane Bond, Senior Fellow at the National Collaborative for Health Equity, where he leads efforts to address determinants of health for boys and men of color. His research interests include men's preconception health and reproductive life planning, paternal involvement in the pregnancy outcomes, and racial and ethnic disparities in infant mortality. He received a BA from Morehouse and a Ph.D. from Howard University. Please welcome Jermane Bond. Jermane, welcome to the show.
Hi, Joe. Thanks for having me.
So tell us about some of those health disparities that disproportionately affect people of color. Do you have some statistics for us there?
Sure, Joe. The top 5, I'll go into those and talk a little bit specifically about those numbers. But overall, the top 5 leading causes of death are heart disease, cancer, chronic lung disease, accidents, and then stroke. Of those 5, heart disease is attributable to about 23.5 or so of all deaths. And for cancer, the second leading cause, looking at about 22.5% of the U.S. population. And then chronic lung disease is about 5.5%. And then accidents or unintentional injuries, about 5% of all deaths. And then for stroke, about 5.1% of the U.S. population. So as we talk specifically about risk factors for life expectancy, we know about the social implications, where people live, where they worship, where they spend time with their families, and the economic issues of underemployment, and then biological factors as well. Just because you have an insurance card, it doesn't mean that you're going to get adequate and appropriate care. Oftentimes, we find that even particularly for men are less likely to have a healthcare provider and to seek care. And so we see these disparities increasingly among African American men in terms of access to care. And then also with regard to life expectancy, we see a significant decreased life expectancy for African American men, and I can go into detail about some of those numbers shortly.
Yeah, I saw the article you wrote recently in the American Journal of Public Health on the lagging life expectancy of Black men. Can you tell us about some of the health trends affecting African American men and how it impacts their families?
Absolutely, Joe. A lot of those trends are affected by where men live, what men have access to, and it's also cultural. We find that Black men are less likely to have a healthcare provider and to seek care, and that men are not often included in reproductive health initiatives as well. And then, most importantly, we talk a lot about the fact that young men are lost to care between early adolescence and adulthood, where young men are not seeking care, do not have a healthcare provider, and therefore don't understand those health implications. And then that has an impact on illness and ultimately impacts life expectancy for some Black men.
And this has an effect on the families as well.
Absolutely. It has an impact on family formation and communities overall, because men, particularly Black men, are not well and unable to support their families financially because of underemployment and low education, and just all around lower life opportunities for young Black men.
So now tell us about some of those reproductive health initiatives that African American men should be a part of or participating more in. What do you mean by reproductive health initiatives, and what are some opportunities or programs available for African American men to participate in those?
Well, unfortunately, Joe, Black men are not a part of those reproductive health initiatives. And when we talk about reproductive health initiative, we talk specifically about what young men have access to and what is promoted. So in general, young men are less likely to see a physician annually or a healthcare provider initially. And we haven't develop sort of what we call a male well visit. And women do have this. Women, as you know, see their gynecologist for their annual checkup, and men just don't have that in place. And so what we're seeing is a low rates of attendance for young Black men to seek help in health care. And when we talk about those health issues, preconception health and care is promoted for women, but not for men. And we talk about, what preconception health and care is and what it entails. It's risk assessment. So sort of looking at the risk that men have, developing risk profiles, and then promoting health and making sure that guys see a practitioner once a year. And then talking a lot about the clinical and psychosocial interventions, which includes mental health, which we don't talk about among men at all.
And tell us about your work with Health Equity Analytics Lab, HEAL, and the work you do and some events and activities you have coming up.
HEAL is a startup that we've developed to start to look at innovative and creative ways to use big data and to analyze data to see if health technology, electronic health records, wearable technology, artificial intelligence, all of these things in technology, and whether all of this technology is increasing or decreasing the health disparities gap. And so we are analyzing life expectancy data from 1900, as we did in our recent American Journal of Public Health article. And we're also looking at infant mortality data and preterm birth data as well to try to figure out if we see improvements and can we attribute those improvements to technology and combining that with real-time data as well to make predictions about what we see happening in the future.
And what are some key ways, Jermane, in which communities can take advantage of technology to improve their health outcomes? Has technology come up in your research as a tool that's underutilized? And But what are some of your recommendations for improving paternal involvement via the use of technology?
Well, first off, I think there are improvements, significant improvements, and I think specifically wearable technology has really increased how people engage in their own physical activity and how people share and compete as well to improve health. But we've often hypothesized that pregnancy is an optimal entry point in the care for many men. As I've said before, we know that young men are lost to care from early adolescence all the way through to adulthood. And so we think that pregnancy is a good point for young men or expectant fathers to start to ask questions and to become concerned about their own care. And we think that there are opportunities to engage young men and men, expectant fathers, during the pregnancy period using technology, particularly wearable technology and electronic health records, and sort of trying to engage guys to think about their healthcare by using technology. And I think there are some things that are on the horizon that we might see some real improvements in healthcare for men.
President Obama launched the My Brother's Keeper initiative to address persistent opportunity gaps faced by boys and young men of color. Can you describe for us how you advocate for My Brother's Keeper to be a partner in men's health?
Absolutely, Joe. That's a great question. I think the My Brother's Keeper initiative has really started a great conversation talking about the life opportunities, importantly improving life opportunities for boys and men of color. And I think a lot of the issues that are of concern for My Brother's Keeper are all public health concerns and should be outlined as a public health imperative. We know that the health of boys and men of color is very important. And we know that earlier this year, the White House sponsored a dialogue on men's health and brought together a number of healthcare providers, practitioners, policymakers, researchers, and community organizers. And the My Brother's Keeper task force was there, as well as the Surgeon General, and Secretary Broderick Johnson came and then spoke about the need to increase understanding in historical factors, institutional factors, and how those factors shape life opportunities for boys and men of color. And there was certainly an importance on the health of boys and men of color, but we need to focus specifically on how we see these interventions having an impact on the daily lives of boys and men of color. And we need to also find innovative ways, creative ways to promote the health of men and look at risk factors and where young boys and men of color live, what they're exposed to, and then also how they eat and look at how they are accessing the Affordable Care Act and if it's improving the health of boys and men or if we need to go back and develop some new interventions.
Jermane, it's been a privilege having you on the show, so thanks once again for joining me. I just want to ask you a few more questions, and then we'll close. Sound like a plan?
Sure.
All right. On this podcast, we like to talk about policy and entrepreneurship and health, but also about what makes successful people like you tick. Tell us, Jermane, what are some habits, tactics, and apps that you use every day to stay on top of your game?
Oh, that's a great question. I do enjoy social media. I spend a significant amount of time getting my news and information from social media. I like Flipboard. I spend a lot of time on Flipboard these days, and I like Flipboard because you're able to create your own magazines and add your own content there. And obviously Twitter, Facebook, I like a lot. Instagram, I think, is an increasingly wonderful app. I'm not a big Snapchat person, but I am learning. And then sometimes Periscope as well. But for the most part, I spend the majority of my time on social media at Twitter and then on Flipboard.
And tell us the name of a book that you read recently that you're recommending to everyone you meet.
Oh, wow. Spending some time recently going back and taking a look at some of the old classics, like The Souls of Black Folks. by W.E.B. Du Bois. But a recent book I've been digging into is Isabel Wilkerson's book called The Warmth of Other Suns.
Fantastic book. I love that book.
Yeah, it's a great one. Yeah. I found it very interesting to look closely and specifically at stories where families migrated and what they migrated to do from the South to the North, and how that impacted a whole host of family issues, cultural issues. I just thought it was a very necessary book. I mean, it's not often that we get those kinds of stories, but that's why.
There are lots of historical tidbits in there too.
Yep.
You've been listening to Jermane Bond, Senior Fellow at the National Collaborative for Health Equity, where he leads efforts to address the determinants of health for boys and men of color. He received his BA from Morehouse and Ph.D. from Howard. Dr. Bond currently lives in D.C. with his wife and 3 children. Jermane, thanks for joining me.
Thanks so much, Joe, for having me.
And that concludes episode 51 of the podcast. Thanks so much to all of you for listening. I can't do any of this without you, so thank you. If you like what we do here, we'd love to hear from you. Please take a moment and head over to iTunes and give it a review. It helps others know what they can expect from the show and helps us out tremendously. Thanks again to all of you for listening, and I will see you back here next week. Take care.
Thanks for listening to the Washing Tech Policy Podcast. You've been briefed.